Hi everyone, my name is Jessica Mills, and today I'll be talking with y'all about a topic that should be really important to all of us as healthcare providers, and that's barriers to healthcare faced by small town America. So to start, I'm going to talk about what is small town America. So the 2010 Census Bureau found that 60 million people live in rural areas of the United States. So that's about 19% of our population. And if you go ahead and look at this picture, let's see, right here, then you can see that much of Arkansas is in red or pink, which is what's considered rural America. So all in red and all in pink are rural. So you can see that that's a lot of the United States. Okay, so when choosing a home or a place to settle down, people might consider distance to the nearest school district or to work, but most don't research the likelihood of a premature death or even distance to the nearest hospital. Morbidity and mortality is often not at the forefront of our minds, but where you live could have a big impact on disease stage you face and even on how you die. So residents of rural areas experience higher rates of premature mortality, infant mortality, suicide, tobacco use, obesity, teenage pregnancy, cardiovascular disease, cervical cancer, mortality related to automobile accidents, and many others than residents of urban areas. So why do we see these discrepancies? Distance and transportation is a big one. The average resident of rural America lives 10.5 miles away from a hospital compared to those in urban areas who live just 4.4 miles away on average. Beyond that, there are almost no methods of public transportation in rural areas, so without access to a reliable vehicle and a driver's license, accessing healthcare becomes very difficult. And then healthcare costs. The 2018 US Census reported that 9.1% of people living outside the metropolitan area don't have insurance, compared to 8.4% without insurance in urban areas. However, this goes beyond insurance. Free and charity clinics are not as readily available to those living in rural areas, and health insurance premiums are often higher for those in rural areas. So poor health literacy. So 19% of rural American residents hold a bachelor's degree or higher. However, this is way below the national average of 33%. Lower educational levels often correlate with poor health literacy, which leads to fear and frustration when assessing healthcare and a greater likelihood of avoiding care altogether. And privacy issues. So if you grew up in a small town, you've probably heard phrases like everyone knows everyone, or you can't keep a secret in this town. While these are often said in a lighthearted, joking way, for the most part they are true. This becomes an issue when talking about healthcare. A person may delay receiving care out of fear that if they discuss their personal health information with their doctor or pharmacist, it won't be long before the whole town knows about it. All right, and then so what are some things small towns are missing? All right, so what are some things that small towns are missing related to healthcare? Access to healthy food. So food deserts are a big problem among residents of rural areas. In my personal experience, living in small town Arkansas, it was a 20-minute drive to a grocery store that sold fresh fruits and vegetables, but I passed 3 fast food restaurants along the way. Prevalence of obesity is significantly higher in the rural South than in urban areas, and obesity has been associated with poorer health outcomes, cardiovascular disease, diabetes, chronic pain, and many other health-related issues. Increasing access to healthy foods is a large part of preventative care. Rural areas face the shortage of practitioners, specialists, and community health centers, leading to less availability of primary and preventative care and a higher rate of emergency department visits than more metropolitan areas. Many of these emergency department visits could have been avoided if primary care was readily available, and often result in unnecessary disease state progression and a high cost of care. And then mental health services. Going along with the privacy issues discussed in the previous slide, mental health services in particular are extremely difficult to obtain in small town America. A shortage of competent providers and a fear of the stigma associated with receiving this type of care often result in an avoidance of treatment. All right, so I actually have a personal connection to this issue that I'd like to share. So in this picture, this is my dad. He was actually in Uganda when this picture was taken. He was there on a mission trip. He's a veterinarian, so he was there helping take care of livestock. And actually shortly after this picture was taken, he was back home. We live in a small town called Hardy, Arkansas. It's in northeast Arkansas. It has about 700 people, plus or minus. And he gets called out one night to his vet clinic for a snake-bit dog. So he goes out there. Everything's good. He's 50 years old at this point. This was in 2016. He is in really good shape. And he's turning off the alarm system at the vet clinic, and his heart stops. He had a tonic seizure that stopped his heart. So at this point, the ambulance was called. And emergency personnel come, and they are able to restart his heart, but he's still in a state of shock. He's in a coma. He has a brain injury from not receiving oxygen for so long. So they take him to our local hospital, but he still needs a very high level of care, and this hospital is unequipped to handle his needs. So at this point, he is airlifted to Batesville, which is still a really rural town if you're familiar with that area. But they're able to take him on, at least for a while. And later in his care, he actually had to be transported to Little Rock, which was another ambulance ride. And then all over the state for rehabilitation. So going through this event and living in a rural area, I was able to see firsthand not only how living in a rural community delayed access to healthcare, but it also was associated with a much, much higher cost of healthcare. So it took longer for the ambulance to get to my dad, and then our local hospital was unequipped to handle his needs, so he had to be airlifted, which delayed treatment. But also the cost of airlifting someone to a hospital is upwards of $50,000, and he had to have multiple ambulance rides, which are also extremely, extremely expensive. All right, so that's just my story. I'm sure that if you grew up in a rural, medically underserved area, then you probably have your own story of not receiving the best medical care. I think that in our roles, it's really important to be aware of this issue so that we can be more sympathetic and understanding towards our patients, especially those from rural areas who may have a harder time accessing care. As future doctors and pharmacists, it's really important that we do as much as we can in the roles that we're in, but also that we collaborate and through like disease state management protocols and furthering access to preventative care for our patients. This way we can be as resourceful as possible for our patients from rural areas who have a hard enough time as it is assessing healthcare. So thank you so much for hearing me out today, and have a great day. Thank you. Bye.